Hi everybody, it's Honest John. Today I'm going to deal with Obsessive Compulsive personality disorder, which is characterized by a preoccupation with orderliness and control. People with this disorder are perfectionists, inflexible, and obsessed with rules and rituals. As a result, when rules do not cover a situation, the obsessive compulsive finds it extremely difficult to deal with. These individuals have a great deal of difficulty expressing emotions, and the ever-changing and fluid nature of relationships is very problematic for them. They are well organized, but overly concerned with details, lists, and rules. Their perfectionism often interferes with completing tasks. They are excessively focused on work to the detriment of their family life. Many of them are hoarders who cannot discard anything. A couple of years ago, I was coming back from a trip, and one of my neighbors in my apartment building was sitting in the lobby reading a newspaper. So I asked him, hey, what's going on in the news? Well, it turned out he was reading a newspaper from 4 months ago. And several weeks later, they actually had to clean out his apartment because he had so much stuff there that it had become a hazard. In extreme cases, obsessive compulsive disorder may involve ritualistic and repetitive behaviors which are completely meaningless. I once worked with a patient who part of his ritual was when he ate, he felt he had to chew every bite 5 times on the right side of his mouth, 5 times on the left side of his mouth before he could swallow it. If he got distracted and messed that up, then he became very anxious. And that's the thing about obsessive compulsive disorder. All this stuff with the rules, the regulations, and the repetitive behaviors and all that is to avoid anxiety, to feel like they're in control. It's not known what causes obsessive compulsive behavior disorder, but if your parents are obsessive compulsive, you do have a slightly higher risk than people whose parents are not. However, this could be because of genetics, or it could be because of growing up in that environment. In working with obsessive compulsives, again, you have to keep the anxiety factor in mind, that the person is trying to feel in control and less anxious. So the treatment usually involves long-term individual therapy, though behavior modification techniques may be used to extinguish unwanted behaviors, and anti-anxiety medications are often used. Now, it's important to remember mental illness exists at the far end of a continuum. So, for example, being well organized and perfectionistic and detail-oriented are strengths and very valuable in certain professions. For example, an air traffic controller has to be very detail-oriented. It's only when these things are carried to extremes that they become symptoms of a disorder. Thanks for listening.